We are the only Boston TV station with a practicing physician on staff. Dr. Mallika Marshall continues to answer your coronavirus questions.
Alice says that her son is moving from a city in Massachusetts to live with her while he attends graduate school. She says he'll get a COVID test before he arrives, and she wonders if he tests negative, does he still need to quarantine? So Alice, it really depends on what state you're in. If you're in Massachusetts, then no, he doesn't need to self-quarantine if he's moving within the state. But if you live outside of Massachusetts, it really depends on what your state's policy is. I would imagine that there are many states that would say if he tests negative within, say, 3 days of arriving, that he probably does not need to self-quarantine, but I would check to see what your state's policy is. Our next question comes from Louise, who writes, I have a sniffly nose and a sore throat for the past 5 days. I think it's a mild cold, but how could I catch a cold if I wear my mask faithfully whenever I go to the supermarket? So you are less likely to catch a cold if you are protecting yourself against the coronavirus, which is another virus, but it's still possible that you could have caught something or out on one of your excursions. It's also possible that maybe it's allergy symptoms, but it's also a possibility that it could be signs of coronavirus infection because sore throat and stuffy nose are on the list of symptoms. So you might want to give your doctor a call to find out if you should be tested. Mary writes, how is it possible that some people that have tested positive for COVID-19 show no symptoms, but others suffer and die? So Mary, we know that there are certain conditions that put you at risk of getting really sick from the coronavirus, things like diabetes, having a weakened immune system, having kidney disease, being elderly, for example. But we also know that there are some people who have no risk factors at all, and they get really sick from the virus and sometimes die. And there are other people that don't develop any symptoms at all. And unfortunately, right now, we don't know exactly why. Our next question comes from another viewer who says she tested positive in April and is wondering if everyone who has a positive test needs to get tested again to show that they're negative. So most people who test positive for the coronavirus don't need to get another test to prove that they're negative, because you might actually continue to have a positive test even though you may not be contagious. So if you ask the CDC when you can come out of isolation, they'll say it should be at least 10 days since the onset of your symptoms and that you should be symptom-free for at least 3 days off fever-reducing medications.